This is the arthroscopic shoulder stabilization post-operative protocol for anterior stabilization. The goals and expectations following this surgery is that the shoulder will become stiff in the first weeks following the surgery. We want to allow the anterior shoulder to stiffen because that's where the torn labrum and torn capsule have been repaired. We expect it to become very stiff following the repair. It will resolve with physical therapy. After surgery, on the day of surgery, you want to use ice or a cold therapy unit over the shoulder for 15 minutes every 1 to 2 hours. Please take the pain medication as prescribed as soon as you have pain. Do not wait until you are in severe pain before taking the medication. I expect that you will be able to stop taking the medication within a few weeks of the surgery. Begin eating liquids and light foods and progress to your normal diet over the next day after surgery. From day 1 until your post-operative appointment, I would like you to keep the dressings on and dry. Usually the first post-operative appointment is 7 to 8 days after surgery. With respect to bathing, you may bathe or shower after surgery, but keep the dressings completely dry and the bandages on. Avoid getting them wet. You're not allowed to swim until the incisions have been sealed after these sutures have been removed. You should wear the sling until your first post-operative visit. You'll continue to wear it for 6 weeks following surgery, allowing for the front of the shoulder to heal. Do not drive until the sling is off. You will begin formal physical therapy 1 to 2 weeks after surgery. We will give you a prescription and a list of facilities we recommend. There are 4 phases to the rehabilitation. There's the early post-operative period from 0 to 2 weeks. From 2 to 6 weeks is phase 1, 6 to 12 weeks is phase 2, 12 to 18 weeks is phase 3, and beyond 18 weeks is phase 4. In the early post-operative period, the goal is to control pain and swelling and to begin a passive motion program. I'd like you to rest and ice the affected shoulder. Wear the sling at all times except when bathing. You are allowed to straighten and bend the elbow and wrist and finger several times a day. You can do shoulder shrugs, scapular squeezes, ball squeezes, and passive range of motion of the shoulder. You want to avoid active elevation of the arm overhead and in the throwing position. You want to avoid lifting objects in that arm. Here's an example of a shoulder shrug. You can shrug them up as far as they can go and hold it for 5 to 10 seconds. Repeat this 10 times. Scapular squeezes involve flexing the muscles between your shoulder blades, trying to pull your shoulder blades together. You should hold these for 5 to 10 seconds and repeat it 10 times. Ball squeezes are self-explanatory. The sling will come with a ball that you can squeeze on the operative side. Passive range of motion should involve forward flexion to 90 degrees. You want to use your non-operative arm to lift up your surgical arm to 90 degrees and then back down again. In physical therapy, we will limit your rotation to 30 degrees, your forward flexion to 90 degrees, and you'll be doing pendulums and scapular isokinetics. Phase 1, the goal is healing of the shoulder as well as restoration of passive range of motion. This is from 2 to 6 weeks. You should wear the sling at all times except when bathing. Your forward flexion will increase to 120 degrees, external rotation to 30 degrees. Avoid actively elevating the arm and avoid lifting of objects in that arm. In phase 2, from 6 to 12 weeks, we try to get full range of motion of the shoulder. We begin a rotator cuff strengthening program. We discontinue the sling at 6 weeks, and in physical therapy, they begin strengthening your muscles, stabilizing your scapula, doing pulleys, pool therapy, and also teaching you a home program. In the third phase, from week 12 to 18, the goal is full range of motion and 90% of strength compared to the non-operative side. You'll do aggressive physical therapy, strengthening the shoulder, increasing range of motion, and doing a home program. Beyond 18 weeks, we want to advance to sport-specific activities. The goal is to return to sports.